Hello everyone, welcome back to my channel. Welcome to Pharmacology Difficult podcast, and in this we are continuing with our series Fast Pharmacology, where we cover a drug in just 5 minutes. I know you're well versed with this series now, but the drugs are latest and they're new and they're FDA approved drugs, so this series is very interesting and very informative. So without any delay, let's get on to our today's drug. Today's drug of the day is Brekiya. Brekiya, and the generic name is a little longer one. It's Dihydroergotamine Mesylate. So this is the chemical name of Brekiya. Brekiya is the brand name, and the dosage form that it is available is single dose auto injector injection, and that injection is also for the subcutaneous use, generally 1 milligram per ml. It belongs to the class of the drugs what we call as anti-migraine drugs. So now that would catch more of your attention. That's a very common problem with many people. So anti-migraine drugs are actually very important drugs. First of all, I'm going to tell you about the mechanism of action. The mechanism of action of Brekiya is it binds to specific serotonin receptors 5-HT1B in the blood vessels and also in the pathways of the nerves, all which are involved in the migraine. When these receptors they are activated, the blood vessels in the brain they are constricted, the pain signals are blocked, and the cluster migraine headaches they are stopped or attenuated. So Brekiya belongs to the class of, also like we get to know from the generic name, ergotamines. It belongs to the class of the drugs that is ergotamines. It was approved by FDA on February 14th, 2025. Now let's get to know some more features of Brekiya. It is used to treat adults with acute migraine, with or without aura, and they can be acute cluster headaches. They are also treated with this drug. How it is given, I told you it's given subcutaneously as injection, and at any point it can be given of the migraine attack. The dose is to be repeated every 1 hour and increased up to a maximum dose of 3 milligram. Then another important thing that you should know about Brekiya is it cannot prevent migraines. Only it can help in attenuating or stopping the migraines, but prevention is not possible with this drug Brekiya, and it is not used to treat any other type of headache. Other headaches include hemiplegic migraines. And what are hemiplegic migraines? In that you cannot move your body to the other side. And other type of migraines are basilar migraines. That's a kind of a migraine with aura, and it's a kind of a very rare type. So in that case also, this drug is not effective. It is only effective in the acute attack and in the cluster migraine attacks. Okay, so that was the overview. Let's quickly cover the side effects. The most common side effects, which can turn out to be serious sometimes, they are squeezing of arteries that supply the heart. So that can lead to seriousness, can lead to coronary artery vasospasm. Second important common problem, temporary decline in the blood circulation to the heart, and that can, if serious problem it becomes, it can lead to myocardial ischemia. Then rhythmic problems, heart rhythmic problems can be there, which can seriously become into ventricular tachycardia or ventricular fibrillation. Then the warnings and the side effects. Now this is a very important point. Brekiya carries a boxed warning for peripheral ischemia when it is used with the medications that inhibit the CYP3A4 enzymes. Yes. So this combination of the CYP3A4 inhibitors along with Brekiya is totally banned. And then there can be some serious problems with the blood circulation or blood flow to the hands, to the feet. So that may cause cramping, feeling burning, aching pain in the hands and feet, numbness, tingling, all these kind of associated problems and feelings and sensations can be there. Other serious problems: heart attacks, heart problems, stroke, then changes in the finger and toe color, stomach problems, intestinal problems, and tissue changes, fibrotic changes can occur in the tissue. So these are some rare, sometimes common side effects that turn into some serious problems sometimes, depending upon the individual and the history of the individual. So that was all about Brekiya today. I hope you really found this session informative. If you did, don't forget to hit the like button. Don't forget to subscribe to my channel. At the same time, stay tuned for more such kind of drugs that we're gonna cover in Fast Pharmacology. Thank you. Take care. Bye-bye.